Well, new research suggests that beta blockers may not benefit the majority of patients. Beta blockers have been used for decades as a first-line treatment after a heart attack. One study found it may even raise the risk of death for some women. Another found no benefit in using beta blockers for any patient, male or female. So here to answer our questions, we bring in, of course, our 9 News medical expert, Dr. Payal Kohli, to talk to us about this class of medications, beta blockers. What do they do, and why have they been used for so many years for heart attacks and heart patients? As a cardiologist, you must have used this as like a first line of defense in some cases.
It's one of my favorite medicines. In fact, I have a colleague who makes a joke that every person should be on a beta blocker. We used to say that because it makes your heartbeats last longer. So think about what happens when you have a heart attack. You have a blockage in a blood vessel providing blood flow to the heart. So you have to try to rest the heart so it can recover, because the heart is a muscle just like your biceps muscle. It can get injured. And how do we get muscles to recover? We rest them. Okay, so the heart is beating all the time. So how do you rest something that's beating all the time? Well, you slow down the number of times that it beats, you slow down the force with which it contracts, and you reduce the blood pressure, which reduces the amount of work that it has to do. So beta blockers, we thought, were the right thing after a heart attack because they rested the heart muscle. And we've been using them for 4 decades. I remember the first patient in medical school I put on a beta blocker, and it's always putting a beta blocker on. That's our favorite medicine to write. And for the first time, we're actually surprised by these findings that we may not need them.
So if anybody that's had a heart attack and their loved ones right now is saying, what? And do cardiologists say maybe we're not going to do them at all? And how could they actually hurt women? That's the scary part.
So let's break it down. So if your pump is busted, meaning you've had enough damage to the heart muscle that the pumping function has reduced, there is no doubt that you will benefit from a beta blocker, because in those cases, you do need to rest the heart muscle. But if you had such a minor heart attack, and especially nowadays, because in the modern era, you have a heart attack, we rush you to the hospital, open up the blood vessel. It's not like the old times when we would put you in a dark room, turn the lights off, and wait for your heart attack to complete. So it created a lot of damage to the heart muscle. Now we kind of fix everything. In those cases, and when beta blockers are not beneficial for men or women, and for women actually who have preserved heart function, they're actually showing harm. Now, this is what the study told us, is that we shouldn't be lumping men and women together. And that was the other surprising finding. All of our data comes from data on men. And we just sort of assume that women's hearts are the same, and they're not. And so in this particular case, men didn't have harm from beta blockers if their heart wasn't damaged. But women without heart damage actually had harm, higher risk of heart failure, higher risk of even dying, 3 times higher
Well,
risk.
symptoms are different for women too, right?
We feel pain differently in our heart. We block up our blood vessels differently. Our hearts age differently. Our heart's shape and size is different. And then after menopause, the effects on our heart muscle are completely different.
So do you think that we should be treating women's heart more aggressively? What would you say as a cardiologist?
Well, and this is what's so sad, Sam. If you look at the same study, they found that women in the study were actually older, had more medical problems, more diabetes, which happens because we present later, but they were treated less aggressively. So they had a higher risk of recurrence. And this is called a gender gap in cardiology. We always, for some reason, a woman and a man hit the hospital, even though the woman is an older patient with more illnesses, we tend to be less aggressive with medication. So I think this is a real wake-up call for the cardiology community that we can't be lumpers. Men and women can't be the same. We have to have sex-specific treatments. And we can't keep doing what we've been doing before, because now that we're opening up the blood vessels, beta blockers may not be causing benefit, but they're causing harm in women.
And I guess women need to say something on
Yes.
a regular basis as a patient. Say, wait a minute, I want you to look at the latest stuff.
So if you're a woman on a beta blocker and your heart function is normal, this is the time to ask your cardiologist, because this is going to redefine guidelines. Do I still need this? And I am taking women off of beta blockers every single day, even men actually, because there's no benefit, there's no risk, but there's no benefit. But it's old data to continue beta blockers after heart attacks. So this has been a really eye-opening study for me, and I'm excited about changing my practice based on science.
I love that about you.
That's good. It's the latest and greatest.
Always
Thank
evolving.
you. And you can find more with Dr. Kohli at 9news.com/Dr. Kohli.